botanical rounds tonight. Are you looking to gain an edge over weight loss? Well, there is an exciting new treatment option designed to help patients lose weight while leading healthier lifestyles. Hartford Hospital is the first in the country to provide something called Orbera. And here to explain is Dr. Darren Tischler, director of the Surgical Weight Loss Center at Hartford Hospital, and one of the doctors actually performing this procedure. And we thank you for joining us tonight, Dr. Tischler.
Thank you, Denise.
Well, first, tell us about Orbera. What is it? How does it work?
Well, Denise, Orbera is a newly approved procedure, newly approved by the FDA for the treatment of obesity and for weight loss, and it's a less invasive, non-surgical option for patients.
How does it work?
Well, the Orbera balloon is actually a silicone balloon that we place into the stomach using an endoscope or a small camera that we place down into the stomach while someone is asleep. The procedure itself to place the balloon takes about 15 to 20 minutes to do, and then patients are able to go home the same day, about an hour or two after the procedure. Once they go home, they'll adapt to having this balloon in their stomach, making them feel full and satisfied. And then we work with a system of a team approach to work with diet, exercise, and with lifestyle modifications in order to help someone keep the weight off in the long run. The balloon is approved to be in for up to 6 months, and then we work with patients for a year in order to help them keep the weight off in the long run.
As you were talking, Dr. Tischler, we were watching a fascinating animation. Right now it is deflating the balloon, if you will. And I was curious, is that balloon filled with anything? Is it air? Is there a saline in there? How does it work?
Yes, Denise. Well, the balloon is empty when we place it in the stomach, but then we fill it up with saline or just salt water. And then the balloon's about 600 cc's of fluid, which is about the size of a grapefruit. So it really fills up the stomach and lets someone feel full and satisfied most of the time.
Okay. Now, what type of patient would qualify for Orbera? Because I don't have to tell you, there are so many options, it seems, between there's gastric sleeve and gastric bypass. How do you know if you're a good candidate for Orbera?
Well, the FDA approved the Orbera for patients with a body mass index between 30 to 40, or that's about 35 to about 100 pounds overweight. Again, it's based on your height. The second thing is we want someone who is really looking to make permanent lifestyle changes, someone who's willing to really work hard with a tool that's going to help them keep the weight off in the long run. And the last part is that it's a non-surgical or less invasive procedure, someone who just doesn't want to make that bigger step to having a conventional bariatric or weight loss surgical procedure.
All right, great information. We thank you so much, Dr. Tischler, for sharing with us tonight. And by the way, I want to tell our viewers that a class will be held on this on October 19th at 6:30 in the evening in Glastonbury. And to register, you can call the number you see on the screen, 860-545-1888. That's again to learn more about this new procedure called Orbera.